A colonoscopy. Yeah, I know. For a lot of people, just hearing that word brings up a mix of anxiety, maybe even a little bit of dread. But what if I told you it's one of the most powerful tools we have to prevent cancer, not just find it? Today, we're going to pull back the curtain and demystify this entire process, from that infamous prep all the way to the moment you get your results. So let's start with a number, just to get a sense of the scale here. In 2025 alone, it's expected that over 107,000 people in the US will be diagnosed with colon cancer. That is a massive number, enough to fill a giant football stadium. It really highlights why we need to talk about our options for prevention. But here's the thing you have to remember. Colon cancer is highly preventable. So that leads to the big question, right? What is the absolute best way to stop it in its tracks, often before it even gets a chance to become a problem? Well, the answer is all about the power of screening. But we're not just talking about finding cancer early. The real game changer with a colonoscopy is that it lets doctors play offense. It lets them find and remove these precancerous growths before they can ever become a real threat. And just think about that timeline for a second. These little growths, they're called polyps, can take 10 to 15 years to turn into cancer. That is a huge window of opportunity. The entire point of a colonoscopy is to find those polyps and get them out, right then and there, basically slamming that window shut for good. Okay, let's talk about it, the part everyone dreads, the prep. For so many people, the idea of the prep is way more intimidating than the actual procedure. So let's just tackle this thing head on and break down what it's really all about. And look, let's be real. Those feelings are totally valid. As Dr. Kunali Soot says here, it's not about pain, but it can be absolutely exhausting. It's uncomfortable. And just acknowledging that is the first step, because there's a really, really important reason you have to go through it. The prep has one single incredibly important goal: to give your doctor a crystal clear view inside your colon. Think of it like this: trying to find a tiny button in a super cluttered room versus an empty one. It's the same idea. If the colon isn't totally clean, those tiny or flat polyps can easily hide, and that would defeat the whole purpose. So the whole process actually starts a couple of days before with a low residue diet. And the pattern here is pretty simple. You're just avoiding foods with a lot of fiber, things that are tough to digest and leave stuff behind. So you stick to simple things like white bread or potatoes without the skin. Oh, and here's a key tip. Steer clear of any red or purple drinks. They can actually stain the colon, and you don't want anything being mistaken for blood during the exam. Now here's what a typical timeline might look like. You'll see it's a split dose prep. You drink half the solution the night before, and then, yep, this is the tough part, you wake up super early, a few hours before your procedure, to drink the second half. I know, it's not fun, but doing it this way is what gets the colon perfectly clean right when it counts. Okay, you did it. You made it through the prep. Congratulations. Now we get to the procedure itself, which, as you're about to see, is often the easiest part of this whole journey. Let's walk through what actually happens in the room. At its heart, a colonoscopy is really just a visual inspection. The doctor uses something called a colonoscope, which is just a long, super flexible tube with a tiny high-definition camera on the end to get a direct, live look at the inside of your entire colon. And here is a fact that really puts a lot of people's minds at ease. The scope itself is incredibly thin. We're talking about the width of your pinky finger. So for a lot of people, the reality is way less intimidating than what they might have imagined. Your comfort is absolutely priority number one. You'll get sedation through an IV that just makes you feel relaxed and sleepy. In fact, most people don't remember the procedure at all. The whole thing usually takes less than half an hour. And any discomfort you might feel, it's not from the scope itself, but from a little bit of air they use to gently inflate the colon so they can get a perfect view of all the walls. So what happens if the doctor actually finds a polyp? Well, this is where the magic of prevention happens in real time. First, they inject a sterile solution under the polyp to lift it up, creating a little safety cushion. Then, a tiny wire loop called a snare grabs the polyp, and it's removed. You don't feel a thing. And just like that, a potential cancer has been stopped before it ever had a chance to start. All right, the procedure's over, and you'll head to a recovery area for a bit. But the journey isn't quite finished yet. Let's talk about what to expect in the hours and days after, and most importantly, when you'll get those results. Okay, the number one rule, the most important one, is right there at the top. No driving for 24 hours. The sedative has to completely wear off. Even if you feel perfectly fine, you absolutely have to have someone there to take you home. The rest of the day is just for resting, drinking lots of fluids, and enjoying your first real meal after the prep. So, when do you get the news? Well, your doctor may give you some initial findings right after you wake up, but the full story comes a few days later in what's called a pathology report. That report is what really determines what happens next. If everything looks clear, awesome. You're probably good for 10 years. If they found and removed a few polyps, your doctor might want you to come back in 1 to 3 years, just to stay ahead of things. Now, while the colonoscopy is considered the gold standard for prevention, it's not the only screening test out there, so it's really important to understand all your options. Let's start with accuracy, because this is a big one. This chart shows how well a conventional colonoscopy stacks up against a virtual one for finding those larger polyps, the ones we're most concerned about. You can see the difference is pretty huge. The conventional scope catches 98% of them. The virtual one is closer to 75%. But honestly, the biggest difference in the real world is this. With a conventional colonoscopy, if they find a polyp, they remove it right then. It's a one-and-done deal. With a virtual colonoscopy, if they find anything, guess what you have to do? You have to schedule a second procedure, a conventional colonoscopy, to get it removed. Plus, the virtual one uses a little bit of radiation, while the conventional one uses none. So here are your main choices, all in one place. You have the colonoscopy every 10 years that both finds and removes, the virtual one every 5 years that only finds, and the FIT test, which is an easy at-home stool test you do every year. But if that FIT test ever comes back positive, what's the next step? Yep, a colonoscopy. It seems all roads eventually lead back here. So after looking at all the options, all the data, it's the natural question to ask. Which screening test is actually the best one? And this right here is the most important takeaway from this whole thing. While all the data points to the colonoscopy as the gold standard for prevention, the single best test is the one that you actually do. So your next step isn't to make this choice all alone. It's to have an open, honest conversation with your doctor about your health, your risks, and what screening plan makes the most sense for you. It's a simple talk that could, quite literally,